Hi, everyone. My name is Tiara Durham, or Tiara. People always ask me which way, and I love both. I am the founder of Colors of COVID, which is a platform that serves as a village for people of color and communities of color to share their experiences, stories with COVID-19 and the impact that it's had on their lives. We also seek to present medical-based information in an effort to quell misinformation and disinformation that exists so much in the world, unfortunately. This is a conversation series that I started earlier this year called That COVI Life, and it is an opportunity to help to shed light on some of those stories of individuals who are facing all kinds of challenges, issues, opportunities, and even some of the positive sides of living their life through the pandemic. And we pair those stories with an expert who can share more about resources and education that can support us as we go through our journey. So today I'm extremely excited to have Dr. Hansa Bhargava with us. She is a board certified pediatrician. She's the chief medical officer for Medscape. And I just am so excited to hear some of the great things that she has to share and some very helpful information around kids, COVID, and mental well-being. So welcome, Dr. Bhargava.
Well, thank you so much, Tiara. It's a pleasure to be here, and such a really good topic. And thank you for all the great work you're doing.
Thank you. Thank you. So what I'd like to do is just start with you telling us a little bit more about yourself and your role as Chief Medical Officer at Medscape.
Absolutely. So I am a board certified pediatrician, as you said, Tiara, and I have had the honor of working with a great organization, WebMD and Medscape. I say WebMD because I spent 8 years of my life over on that side of our organization, and then moved over to Medscape last year. Well, not last year officially, but I did some work for them last year, and then moved over officially this year. And it's been wonderful. And the reason why it's so I really enjoy the work that I do is similar to you. I'm basically armed with or tasked with providing good health information and valid health information, factual health information that's relevant to people. And so on the WebMD side, I was doing that for patients and people and families and everyone under the sun. On the Medscape side, I do that for doctors and nurses and clinicians and pharmacists and everyone in between that makes up the healthcare team. So I'm privileged and honored to do that. It just, to your point, Tiara, especially now, I think it's really, really important to get information out there.
Absolutely, absolutely. And can you tell us a little bit more about WebMD? I know WebMD is more of the kind of the consumer arm of the two companies, and Medscape is much more physician focused. Can you talk a little? I research information all the time, and WebMD is one of my favorite places to get some consumer friendly information.
Well, I'm really glad that you do use WebMD. WebMD is one of the few organizations, and I'm not trying to toot our own horn, but one of the few organizations that has doctors and taking care back end to make sure that the information is accurate and relevant. We're always in the mix in terms of the news and the research that's coming out there. We have an award-winning news team that makes sure that we get the information out there that is relevant at that time for people. We've been very much at the forefront for COVID-19, obviously, as a public health organization, and Medscape similarly tries to stay relevant to the healthcare team. Arm that I have the most work in is medscape.org. and that is basically making sure that physicians and nurses are getting their continual education that they need as well. So always keeping our healthcare workers up to date, which is just, it's hard as a healthcare worker, and I can say that personally, to make sure, you do that in addition to all the other you're doing, and especially in the last year and a half, saving, lives. I mean, my colleagues a lot of them are on the front lines, and I just want to do a call out to them and say and respect how hard they have been working, and just how much we appreciate them.
Absolutely, absolutely. It's continually almost unimaginable that the role that our healthcare professionals put themselves in every day, and so it's certainly a blessing to have them. Yeah. So a little bit more on our topic. I was digging around on the internet for some great evidence-based information, and I found some information on the American Academy of Pediatrics. And so just as of September 16th, over 5.5 million children have tested positive for COVID-19 since the start of the pandemic. And nearly 226,000 cases were added just in the past week, and the third highest number of cases in a week since the pandemic began. And so we've had a decline in over the summer, the early summer. But cases have increased since then, with over 925 cases just in the past week. I'm fascinated and thankful that children still are not as affected by the severe illness of COVID-19. And that's really thankful, really good news to know, I know. But there's still more information that needs to be collected around the longer term impact, not only the physical impact, but also the emotional and mental health impacts. And so I know that's part of what we'll talk about today. So COVID is still here, and parents may be asking, how do we keep our kids safe and healthy during this tough time?
Yeah,
what can you share with us?
Yeah, and you and I both know what a battle it's been for all of us, right? The constant and doesn't seem to go away, and then there's surges, and we may have slight lessening of the surge, and then it's back again. There's different variants, and it's all over the news, and I think it's been hard. So I'll answer it in two parts. So first of all, I just want to comment on COVID in kids. So I think that the fact that we have vaccines, I can't emphasize this enough, Tiara. I mean, it is truly amazing, right? Like, if you actually look back at how long it used to take to get a vaccine out there, I mean, I think somehow we lost the awesomeness or the understanding how incredible that is that we were able to get a vaccine out there. And the other thing I'll comment on is the fact that we in the United States have access to these vaccines. Greater than 90% of the countries probably around the world still don't have that access to vaccine. It's just terrible. I was born here in North America, but my ancestry is Indian, and I can tell you, because my parents are Indian, people in India went through a lot with the Delta variant, and the vaccine was just simply not available there. So I guess as a pediatrician prior to COVID and a pediatrician in COVID, I'm just honestly astonished at why people would not take this opportunity that 90% of the world does not have to get the vaccine, to have that safe and effective vaccine. So I'll just say that. Now, having said that, I do think, and we see this in the hospitals right now, that not over 95% of cases that are hospitalized are unvaccinated patients. So there is a true protective quality by the vaccine, however you want to slice it. And that is true for children. So, right now, again, just really grateful that the vaccine was approved for ages, 12 and up. And the fact that our kids, can get that vaccine, get that protection. My kids who are teens are both fully vaccinated. So going back to your question, Tiara, how do we protect our kids in the time of this pandemic? Number one, get vaccinated. And you know, I hear stories from my friends who are in the front lines of people, kids who are being orphaned. So, you know, yes, the kids generally don't get as sick, thankfully. You know, if you look at the numbers, yes, there's 5.5 million cases, but, you know, still less than 2% of all kids with COVID are hospitalized. Well, that's wonderful. However, that's not true for adults. So if you are a parent, you know, it's just like anything else. You know, when I'm a parent and I think about, you know, when I think about safety measures, I try and say safe and healthy my children, right? And so it's really sad that so many children are being orphaned or have lost their mom or dad. Why? Because the mom and dad elected not to get vaccinated. So, you know, I have held back a lot about this issue, but I'm not going to anymore because the science supports it, we know. And if there was any concerns about the vaccine when it came out, gosh, millions upon millions have been vaccinated. So at this point, that argument just doesn't hold. I'm sorry, unless your doctor says for some reason you cannot get vaccinated. So I'll just say that. So number one, get vaccinated. Number two, you know, be safe, like wear the masks. I wear the masks in crowded, you know, if I'm going indoors, I'm wearing a mask, even though I'm fully vaccinated. So, you know, Delta variant is very contagious. It's a good idea to wear it. You can, unfortunately, have breakthrough cases, although it's rare, even if you're vaccinated. So why not put a mask on? It's great. And my kids wear masks to school every day, even though they're fully vaccinated. As per the school requirement, even if it wasn't required by the school, my kids would be wearing masks every day, even though they're fully vaccinated. And then, you know, just being really smart. I mean, I think I've always said this since the start of the pandemic, Tiara, we can live. We can live. We just need to live safely. So to me, it's like, gosh, am I never going to get into the car because I know that car accidents are happening? Right. I will get, but I will put on my seatbelt and I will stop at the stop signs, right? So you do what you can and you live safely. So there's no reason that we cannot go out with, you know, friends and socialize and do all the things, but we just do it safely. We choose out. We wear masks indoors, we get vaccinated, you know, we make sure the people we hang out with are vaccinated. So those are some of the ways I would advise parents to be safe and be healthy as a family.
Yes, yeah, and those are extremely important points. I mean, you know, we do feel as parents, we feel that we're the best protection for our daughter. Who's 6 years old and is not able to get vaccinated right now. And so we were very, you know, it was discouraging. Last summer was discouraging, but to come into 2021 and hope that we could have traveled more over the summer would have been great, but we really held off because we know that she's at risk and we didn't want to expose her. Even though we were vaccinated, we wouldn't want to put her through that. So, you know, we also wear our masks everywhere, but we've also continued to stay around the house and not venture out as much as we probably could for her safety. And so it's exciting with the news that, and I'll ask you something about it a little bit later on, but the news of possibility of vaccine coming for emergency vaccine for children. But let's talk a little bit about the mental and emotional component when it comes to children and COVID-19. And I just have to say briefly that my daughter's an only child, and last year was an intense struggle for her to be by herself in the house, asking two adults to entertain her 24/7 was just more than I felt like I could take. And I know that I'm not alone, but as much as it was difficult for me, I felt so incredibly bad for her and what it must be doing for her from a mental perspective. And it's so funny because I think she coined this term, but she would tell people like, I don't want you to come over because I don't want to get kid corona. She called it kid corona.
Oh,
I know. It's so funny.
that.
Yeah, she's like, I don't want kid corona. So
I love that.
what can you tell us about some of the issues facing children in that regard?
Yeah, Tiara, you know, you hit the nail on the head. Like, you know, it was very, very hard for many groups of people, but certainly parents and children. So, you know, what you described about the guilt and keeping her online for school and kind of, you know, keeping her entertained without, you know, the usual friendships or soccer games or birthday parties or like everything else that was kind of taken away, was mentally draining for parents, for caregivers, and for children. And I'll just add to that list, like the list goes on, but the other group of people that I think really suffered were senior citizens too. So, you know, I think that it has been really, really hard for us. And as humans, we do, you know, we are resilient, but the thing is that it has been such a changing trajectory, and that, you know, often what we look for as human beings is a ray of light. And so as soon as a ray of light comes, we're like, oh no, that wasn't a ray of light, you know, like, and so that's kind of hard to take, right? Like where is the light at the end of the tunnel? Oh no, that was just a mirage. Like that is hard, right? That's hard on our humanity, I think. So I think it's been really, really hard. There's been specific groups of people, I think, that's been harder on, and some of those I named. The other groups of people I'll certainly name is people like who might be, you know, having disparities, Tiara, like, you know, economic disparities, you know, racial disparities. I mean, the list goes on and on. I mean, rural disparities where there's, you know, healthcare deserts. So, you know, it goes, you know, it just goes on and on. So we all suffered, but there's certain segments of the population that probably suffered more. But here's the thing, like, the issue, I think, was that not only did we have this changing fear and element, but then we added on the fact that media was talking about it 24/7. So there was just no getting away from it, right? And then the third thing was that, you know, social distance or physical distancing was really, really hard, because humans rely upon socialization as a buffer against stress. So from a biological perspective, you know, the sympathetic system, our fight and flight response, gets activated by fear and stress, right? And so we're all the way up here. And the parasympathetic system, which kind of brings us down back into what they call the zone of wellness. Like if you look at EKG, like you kind of want to be over here, not like that, and you don't want to be down here. So it's similar, the zone of wellness. And the parasympathetic system actually brings us down. So what is in the parasympathetic system? What are the buffers? One of those buffers is socialization, connection, companionship, like all the C's basically, that kind of brings down. And what did we do in the pandemic? Took away all of those. Right. And yeah, so I think it's not surprising that, you know, mental health illness has been, you know, escalating. Absolutely. Yeah.
Mm-hmm. And could it have been avoided? I mean, why did it? Was there any other way we could have managed through that?
That's a Tiara. I think, unfortunately, when we first found out about the pandemic, we didn't have that much information. Mm-hmm. And so what the public health authorities said was absolutely correct, because they needed to be safe and you know, conservative about it until they knew more. And now, you know, what the public health authorities suggest, vaccinations and masks. Well, I can't remember the last numbers of people are vaccinated, but if more were vaccinated, then we would be, you know, and you know this as well as I do, Tiara, we would be at a different place. So, you know, yes, we could have done things, you know, in the last maybe 6 when the vaccine came out. But unfortunately we're not. But now, you know, the question becomes, okay, so we have increased anxiety, like really increased anxiety in kids. We have increased depression. We have increased suicidality. The kids who are showing up in the ER, the ERs are being bombarded, not just by, I mean, the adult ERs are probably being bombarded by COVID. The kids ERs are being bombarded by COVID and mental health issues. So it's a real concern. And I think the only other thing I would add, and I'd love to get to talk about this as well, Tiara, is all of these things can contribute to anxiety for kids, but the other really big thing that can contribute to anxiety for kids and depression to kids is the state of parents as well.
I had a feeling you were going to say that. and God help us if we're depending on parents' mental stability. I'm just kidding. That was a bad joke.
I'm a parent myself.
Yes.
So it's been hard. It's been hard for caregivers, and it's been hard for parents, and that's why, like, I have written a lot about this, and I write for Forbes, and I have a book coming out, but I talk about the parents. I mean, you have to have self-compassion, because if you aren't taking care of yourself, I promise you the kids know it. They're like little sponges, and you know this, right, Tiara?
Yes, absolutely.
Yeah, so I mean, we do need to do that.
Well, what it brought to mind was, last summer, the panic that my daughter's, the parents of the other kids in the school who would send me text messages or emails and say, can we have a Zoom date? Please, can our children have a Zoom date? And we'd set our kids up on Zoom, and it was helpful. It was very helpful for them to just be able to interact with each other through Zoom, to do nothing more than say, hey, here's my room. This is what I'm doing. I'm just hanging out. It gave them some sense of normalcy. And that was very helpful. And I think, I don't know if those cries for Zoom dates were more for the parents or more for the kids, because I definitely struggled. I have to say, I honestly struggled. And there's the level of guilt that's on top of, like, why you can't, like, want to play one more game of Chutes and Ladders with your child. And it's really hard. And so, and then we were all layered with the fear of COVID, right? We were afraid to go out and grocery shop back then. And so I think things have changed a lot, and I'm glad that we were able to get our vaccines, that we're able to wear masks and go out and have some more sense of normalcy. My daughter's back in school with a number of COVID restrictions, which, I really applaud our school for being able to put the type of restrictions in place that would allow them to safely return. So tell me, what signs should parents look for when it comes to seeing emotional distress and anxiety in their children?
Yeah, and I think that's a great question. It can manifest in so many different ways. I mean, usually when we think about depression or anxiety amongst ourselves as adults, we think, not a great mood, not eating well, not sleeping well, having headaches, being irritable and angry. Those are all similar signs for kids for depression. The additional signs that I would add for kids is that they sometimes manifest with bodily symptoms as well. So they may actually, like your daughter's 6, 7, 8-year-olds not typically, but often will complain of stomach aches. And so, they have these feelings and they're not sure how to cope with them. So sometimes it turns into stomach, not that all stomach aches are depression or anxiety, but it's just something that you might raise the pediatrician or your physician about if you're worried. Anxiety, again, similar symptoms. I mean, just disengagement from activities that they're interested in. They're just not feeling engaged, excited about things that they used to stay excited about. Are they slipping? Are they complaining of headaches? Are they complaining of something else? But those are some of the symptoms that parents can look for sure. I think that if you are worried, you should definitely chat with your pediatrician. That's probably the first place to start for those symptoms. If your kids are older, then perhaps psychologist or psychiatrist who could also help, but definitely seek help, because unfortunately we are at a point where we are seeing a lot of this, and then there are some tools. I talk about a toolbox that are kind of preventative in terms of mental health illness. I talk a lot about that because I'm not saying that all mental illness can be prevented. That is not true. Unfortunately, just like, I was talking to a doctor the other day. I'm like, well, there's prevention tools for hypertension and diabetes, but, and we were talking about it and we were like, yeah, but some of it's preventable, but some of it might be genetic. And some of it, so you can't go out there and say, oh, well, type 1 diabetes is all preventable. That's simply not true, because some people get it and, they didn't, there's no reason. It's just genetics and environmental. So similarly, for mental health, some people have mental health illness, and I'm really glad that there's awareness of it, and it seems to be that the stigma is decreasing around it. So hopefully a point where it is treated like physical health issues. It should be, because it can impact every part of your life. But for kids and for families, I think if there are some preventative, and I would say the mental health toolbox is what I would call it, actually, and everyone those tools.
Awesome. Yeah, thank you for sharing that. I think anything we can do to better arm ourselves to be on the lookout for the signs, the better off we'll be. Is there anything, so arming ourselves with tools to look for signs is certainly a good step. Are there preventative measures that we can take?
Yeah, and I'm so glad you asked me that question. Just like we can take preventative measures for cardiac disease, where we do exercise and eat right and, try and get enough sleep. Similarly, there are preventative tools for mental health issues too. Now, some of those tools really begin with like knowing how to activate the parasympathetic system. Like we talked about, you don't want to be like this. You kind of want to be in that frame of mind where you're in a rhythm. And some of those tools include like deep breathing, visualization, but they also include things like hugs. Did you know that? Yeah,
hugs feel great. So I imagine it would work. Yes.
I've used that tool with my own kids, like when they're frazzled. It's like, okay, come over here.
Oh, I see. Yes.
A hug, if you hold it, can actually release oxytocin, which is a calming chemical. So hugs, deep breathing, visualization, meditation, lots of research on that. And people always roll their eyes when I say that, because it's like, oh yeah, like as if I can meditate. But if you even just start with 5 minutes a day, it's like saying, oh, well, I can't lift that 20-pound weight, or I can't lift that 40-pound weight. But you don't start with 40 pounds, you start with 5 pounds, right? Which is, I'm at 5 pounds right now, by the way. So, and I'm up to 10 minutes of meditation. So
that's
got
great.
that.
Yes. Yes.
So those are definitely some ways you can do that. Here's the other activation, Tiara, that I think is really important. Connection. Like connection and socialization is really important. So yes, we want to stay safe with COVID, but here's some of the things that I have suggested. Like, and it's basically trying, like right now the weather is good for most of us. Actually go ahead and try and be outside, do outdoor events. Have your mask. Sometimes if you're vaccinated and you're outdoors, you may not need the mask, right? You're far enough, you can do that. So outdoor events are great. Getting to either like a community thing. I talk about, church was obviously something that was really, which is great, but some people may not do that. And so therefore find another community event. Is it your community center? Is it even like the restaurant down the street, like which has outdoor seating, and you can, and hang out with friends, where like that Cheers, nobody knows Cheers here because everyone's too young, but where everybody knows your name, like, you know what I mean? When you walk in and they're like, hi, and I actually have, I do outdoor spin. So I walk into the club and they're like, hi, Hansa. And I'm like, these are my people, right? So having a place where you have your people, right?
Mhm.
And I see somebody else likes cheers. That's awesome.
Yeah.
And so, yeah, I think community is really, really important. I call it the circles of care, Tiara. So circles of care start with C. So compassion for yourself, right?
Mhm.
Compassion for the circle that's tightest around, but building the other C, which is community. And then there's another C, which is, connection to others, like we're connecting right now, Tiara.
Mhm.
And then the fifth C, which is really important, and people may not know this, is compassion to others.
Mhm.
And the reason why compassion to others actually is so important is because that the compassion that you give to others, and I wrote a piece on this, Tiara, and I'll send it to you in case others are interested. I went through a really rough time last year. There was a lot going on in my life from a personal perspective. And I went in and out of sadness and frustration and depression. And then my dad got sick. So I was really sick in the hospital. This was before COVID. And then my sick. And so there's events that happened. I was not in a great place. But then, I reached out to my friend who's going through cancer. And, she was going through a really, really rough time. And so one day I actually took tea to my friend and we sat down and we chatted outdoors, because then now it was COVID, with masks. And here's the thing, like the benefit, you may think that, oh, well, she benefited from me bringing the tea, but actually I benefited because I saw that things could be worse and that everybody goes through stuff. And I felt good connecting to her. And I felt good about doing something that I thought maybe will just add a little smile to her day. So, being compassionate to others is very much giving ourselves to, and there's been plenty of studies to show how it's the centers in our brain that are the pleasure centers. So just like there's a pleasure center for the runner's high, there's actually a pleasure center for compassion too.
Well, I couldn't agree more. There's some comments in the chat. Karen says she loves those circles of C. I do as well. I mean, care is like one of my favorite words because everything to me is summed up with care, and I think your circles of C is very similar. You've got compassion for yourself, compassion for your inner circle, compassion for others, and connectedness and community is so important. Just to, I don't know, it's, we shouldn't, no man is an island. We should always try to help and support each other. And selfishly, it feels really good. So
yeah,
it really feels good. Yes. Karen also said somatics and sound baths when you were talking about some of the things that you could do with children.
Yeah.
I had my first sound bath a couple of years ago, and that was super awesome. It was really great. I love that.
That's awesome.
Yes. It's a great way to, if you're trying to meditate, sound baths are a great way to start, I think.
For sure.
If you don't fall asleep.
So. Yes, I have that problem too.
Yeah. So I want to, while I wrap up with questions, I do want to give the audience an opportunity to ask questions. So if you have a question, feel free to drop it in the chat. And I'll ask a few more questions. And if you don't want to drop it in the chat, feel free to come off mute to ask your question. But while we're waiting for any additional questions to come in, I wanted to circle back to vaccines. I know that Pfizer has, made an announcement that they have an effective vaccine for children, I think 5 to 11. And certainly that hasn't been approved yet. Do you have any thoughts on children and vaccines and how parents can arm themselves with the right information? Where should we go to get the right information?
Yeah, absolutely. Great question. So yeah, I did see that Pfizer announcement and, they've had some good results from their trial. The trial has shown that there is efficacy, i.e. there is antibodies being produced to the vaccine, and safety, that there's been, no adverse reactions in their trials. So it is definitely hopeful. I still do think that it's really important to go through all the steps that are necessary. Those steps are there for a reason. It's, it's to make sure that the data is correct, that there's outside authorities, outside of Pfizer and outside of industry, not Pfizer, I'm not picking on Pfizer, I'm just saying those steps are because we want to make sure there's outside people who are looking into these kinds of things to make sure that an outside person is taking an objective view and looking at all the data. So there's several. There's the FDA, who I think do a good job of also deciding which vaccines should have emergency use authorization and which should be approved. So I think it's definitely positive news, but I think we need to wait to make sure that we, check all the boxes and dot all the I's and T's.
Absolutely, absolutely. And so beyond the vaccine, we've talked about ways of keeping ourselves mentally well, emotionally well. Do you have any recommendations for resources for children? Are there places that you like to go to get, there's Calm for adults. Do we use our Calm app for our children? Or are there kids apps that are out there helping with things like meditation and breathing?
Yeah, I think so. Well, a couple of things and I talk about this a lot is to be really intentional about the kids' schedule. I think that, often we start keeping up with the Joneses as parents. Everyone's friend is doing soccer, everyone's friend is doing that, but, we can chase after that, but just, think about how scheduled your child is, how scheduled you are, and take those spaces. I cannot emphasize enough how important it is to take the space for you and for your kids. So I would say look at the schedule and make sure there's spaces built in, not only for family time, but just like nothing time, like just quiet time, nature time. Outside, because nature again has been scientifically proven to elevate mood and help us with our mental health. So that's really important. The second thing that I have done personally, and I have teenagers, so they're a tougher crew to convince. They don't think I know anything.
No.
That's
I completely understand.
But in the ideal world, I would love to take those phones away from them for periods of time. And to myself, what I do is I actually I make some small changes to lessen my screen and media exposure. So that might sound funny from someone who works in digital communications and media, right? And it certainly has its place, but just like anything else, it can be a double-edged sword. So I think it's really important to know your media consumption, especially of bad news, because often what we find is that the news is circulated and it's not necessarily new news, but it's stressful news that's circulated, and we don't need to hear it 24/7. That stresses us out and puts us into the sympathetic overdrive, right? So to avoid the sympathetic overdrive, that's important. So I would say those two things are really important that we forget about. Sometimes we do talk about sleep and exercise, and obviously that's really important. But the pause and the taking away of the screens and the media is really important too.
Yes, I have to say, I have to tell just a really quick story because, we struggled with screen time last year with an only child, and especially in last summer. This summer has been much better, but last summer it was like, well, what do? We don't want to just inundate her with cartoons and things like that. But we set out to get a puppy last year, and it took us to just about 3 weeks ago to get our puppy, but we finally have our puppy, and our puppy has done so much for getting our daughter outside even more. She loves to go outside and run and play, and she really, I find it interesting because at least for her, being on an iPad is her last choice. That's the last thing she wants to do. She really would prefer to be with us, making something in the kitchen or playing a board game or putting a puzzle together, and having having our little, what I call him pandemic puppy, but having him now has really brought some additional peace and relaxation. I know there's data to suggest that animals are very helpful. Very helpful for mood.
Yes, I would add that to that list of like parasympathetic activators. There's no doubt about it. We have a dog too, and we've been so grateful to have her. She is just truly precious. So yes, absolutely, absolutely.
Great. So I see one question in the chat. Do you have advice for child-friend safe activities as we move into the fall, winter months? That's a great question. Child-friendly safe activities.
Great. Well, I think a few things that it's somebody's putting something up there. That's great. Yes. So my suggestions are activities are awesome, and I know that the United States is colder, but you know, I'll tell you, I grew up in Canada, so that doesn't faze me at all.
Mm-hmm.
We used to play outside all the time, like in the middle of January with snowsuits on. So I think the outdoor activities are great. They're safe. The kids love it, depending on, you know, how old they are. Even for older kids, I would say, you know, throw some hoops. I mean, throw the football around, you know, go for a walk. I mean, you get the exercise, but you also get the sun, which is not only great for vitamin D, but it's a mood enhancer. So, so I think being outside, if you can do nature, oh my God, nature is so calming. Do a family hike. I mean, if you could just build in a family hike every Saturday, for example, like, or Sunday, whatever day works for you. But I think that is just a wonderful, wonderful thing. So that's something I would suggest. I think that if you watch some kid-friendly movies, that's great too. Whoever comes over your house, make sure they're vaccinated, and you know, I usually have I have friends who have young kids, and my sisters do, and I always say the mask on and a little bit of separation right now, even especially the young ones who aren't vaccinated. So, but I think you can do that for short periods of time, and have those play days, Tiara, because I think that's important. But you know, playing outside, I think is probably the best thing. And then, you know, for families, I love old-fashioned board games. You know, I think family time, I would say probably the two things I would add to my calendar if I had younger kids, not teenagers, is really the board games and the family hike. So yeah.
Yes, absolutely. Yeah, we definitely brought board games back. Puzzles are a big one. We've watched it. My daughter has watched her first set of series, so that probably sounds horrible, but we did take in a few series together on Netflix. So
That's awesome.
And Karen says gozen.com for resources that can be modified for younger children or adults. For anyone who's interested, gozen.com. Now, Ben has a question that's probably more geared to the 65 and older group. It says thoughts on booster shots. So Ben, I'm guessing that you mean 65 and older because of what the FDA has said, but let us know if that question means something different. Any thoughts on that?
Yeah, I think, you know, the FDA has, you know, has given the green light for the boosters for over 65. I think it's a good idea. They are at most risk. And as for the rest of us, I think I really would follow what the FDA leads, basically. And, you know, they are very data driven. I can't emphasize how important it is to look at data. And, you know, that's where we get the most objective evidence. So yeah, I would wait for their call on that.
Thank you. Thank you. Any other questions from the audience, either through the chat or feel free to come off mute if you have a question or a comment. All right. So I will say I didn't know that you were from Canada. I'm so glad to hear that. I went to Canada for the first time and had the pleasure of going to Vancouver, which was really cool.
Oh, no, I haven't been up there yet. I need to go.
Yeah, it's very, very cool.
Is it pretty? Must be, right?
Beautiful. It was absolutely beautiful. But glad that you're here to bless us with with your insights and perspective and medical background as it relates to kids, COVID, and mental well-being. I do want to give you an opportunity before we wrap up to share with the audience anything that you'd like us to know about how we can follow you. You mentioned that you have a book coming out. I would love to hear more about that. Before we wrap up, just let us know what we can do to continue to support you.
Oh, thanks, Tiara. Well, first of all, thank you so much for having me here. It's been such a great conversation, and no, it's been delightful. So I do have a book coming out. It is actually being published by the American Academy of Pediatrics, and it is Building Happier Kids. And it's actually has a lot of stories of my own journey as a parent, actually, Tiara, and how, like, you know, I turned from probably tiger mom to like calm mom, and my journey as a pediatrician too, through things that I saw as a pediatrician to. So yeah, so that talks a lot about like the circles, for example, the circles of C. I have circles of control in there, you know, self-compassion. There's a whole chapter for parents in there, and you know, and just how to build it into your life. The mental health toolkit, it's all in there basically. And a lot of the things that I talk about in that book is from the CBCT course that I trained in at Emory University. And that course is called Cognitive-Based Compassion Training, and it really it's 10 modules, and it starts with self-compassion and, you know, nurturing yourself out to diversity and inclusion, and compassion for others. So it's that entire you know, journey. So I have based a lot of the things that I talk about there, and I would highly recommend taking a look at that. If you Google it, you'll see it. That program is out there, and it's out there for the community. It's done wonders for me, I'll be very honest. And so for me, I would love for you to follow me at, you know, I have all the social handles at Dr. Hansa MD. That's on Instagram, at Hansa Bhargava MD on Twitter. I'm on LinkedIn. And, you know, I also obviously can be found at Medscape and WebMD. So yeah, would love questions that you might have, and, you know, absolutely thrilled, Tiara, that you're putting this factual information out there with your
Absolutely, absolutely. Well, thank you so much for joining us. It was an absolute pleasure to hear from you, especially when it comes to when a topic as important as our children. And so I look forward to continue to follow you, and can't wait to pick up my book so that I can be prepared.
It's on Amazon.
Get my circle of C's together.
You can actually pre-order it on Amazon if you're excited.
Awesome. No, I definitely will. I really think it's cool that it's when you have friends that publish books, I'm getting everybody's signature, and I want to pass that collection on to my daughter. So, you know, I think it's great to be able to you know, to have people in your life who are doing great things in the community, and we really appreciate the work that you're doing. We thank you for joining us on That COVI Life, and to join Colors of COVID. If anyone wants additional information about Colors of COVID, you can find more information at colorsofcovid.org. And you can follow me on all the social media channels as well. Thanks again for your time. There are a lot of thank yous coming through in the chat. Have a great afternoon, everyone.
All righty, thank you so much.
Thank you.
Oh no, it was great. Thank you so much. I don't know if somebody was asking for the book post.
Post the link in the book. Yeah, for the book in the chat. Absolutely.
This is really a great conversation, Tiara. Thank
you. Thank you for all the folks who joined. I have to shout out my Tufts crew, my Tufts alum crew. We've got some New Jersey folks who joined us, and a lot of great folks. Ben, oh my gosh, is that Ben from high school?
It is.
Okay, I'll chat with you later, but it's so
That's
great.
Right.
Thanks, everyone.
Thank you.
Thank you. Bye-bye.
Bye.
Take care.